Hi there, Mark Jabin here, Medical Director for the Haywood County Health Department, and let's talk about this pandemic. In this video, the CDC recent changes to the quarantine period and what it really says. So please share this video with someone you care about. Now, many people think that the CDC has changed the quarantine period. In fact, that's not what was done. And let me explain. First, be clear, nothing changes if you are sick or test positive. For you, isolation for at least 10 days, totally separate from family. And by the way, this is where we see a lot of spread when people aren't or don't isolate fully. This new CDC guidance only affects those who are close contacts and are asymptomatic. Close contact is defined as when you are in contact with someone who is a known positive within 6 feet for more than 15 minutes without wearing a mask. What the CDC actually said is that the quarantine period for a close contact exposure remains 14 days, but there may be options in how to manage this time period. So currently that 14-day period is managed in total separation at home, away from others, especially family. This means in a separate room and hopefully separate bathroom, and if there must be interaction with family, everyone wears a mask, keeps distance, and washes hands, and this interaction lasts for as little time as possible. The new guidance introduces two options, but each option still requires 14 days of vigilance. So what each does do is allows for not having to remain in full separation for the full 14 days. So option one, the full separation can stop after 7 days from the last day of exposure with a negative test performed no more than 2 days before. Although not specified, this should be a PCR test, not a rapid antigen test. Option 2 is full separation can stop after 10 days since the last day of exposure, even without a test. But for each, this requires the person to remain fully masked at all times, especially around family, with distancing and good hand washing all the way through day 14. And if this is not possible, or the person cannot or will not adhere to this, then neither of these options should be used. The virus has not changed. The incubation period remains 2 to 14 days, meaning after day 7 and after day 10, you could still become contagious and your symptoms could still start even at that time. In Haywood County, roughly 20% of those in quarantine, 1 out of 5, who become positive do so after day 7. And we've already had a case of a public service worker released at day 8 after a negative PCR test at day 5 and become very ill on day 11. The risk of either option is that someone contagious is out and about, continuing to risking spread to others. So when should we use one of these options? Well, first, these are not an option for any congregate living situation, like a long-term care facility or a detention center. There's just too much risk. Second, if your circumstances at work or at home do not allow you to follow through for the entire 14 period, too much risk. Third, if you can't or won't follow through, too much risk. And if you can comply and will comply, these options do give the opportunity to get back to work sooner, as long as your place of employment is not congregate, meaning you aren't on top of others or in close proximity with others in order to do your work. The key concept here is congregate. So clearly the current 14 days of separation is the safest path to manage quarantine. The CDC believes that the risk of shortening the period of full separation outweighs the risk of contagiousness in the community if more people will at least be willing to comply with the options and the need for following the full recommendations through the full 14-day period. So whether or not this makes sense for your situation, whether or not it actually is safe, depends on what you do. And given the modifications we've had to make at the health department until we can get caught up, it is now up to you and your employer to decide what you can accept. The health department will no longer be able to provide clearance letters until we can get ahead of the current surge in cases. At that time, we'll go back to the way that we were doing things before. So whatever you choose, whatever you and your employer choose, be well and be careful, especially right now.